Hello, everybody. My name is Nolan Sullivan. I'm the Director of Health Services here in Sonoma County. We're starting something kind of new and fun. As I'm learning the county, I'm learning that we have so many amazing nonprofits that do wonderful, wonderful work here in the community. And one of my new favorites is the Redwood Empire Food Bank. And so hopefully over the next 20 or 25 minutes, I'm going to ask some questions. I'm going to learn a little bit. Hopefully you'll learn a little bit too, and we can learn how we can work together and partner and support those in Sonoma County that have unique needs. And so I've got Allison Goodwin here today, who is the executive director over at Redwood Empire Food Bank. And we're so excited to have you, Allison. This is our first little recorded, we'll give this a catchy name at some point in time, but very excited to have you as the first guest today. Can you tell us a little bit about the Redwood Empire Food Bank, kind of what you do, how you do it, and kind of what is the food bank?
Sure. So thank you so much for having me. We're happy to be the kickoff nonprofit to share what we're up to. So the Redwood Empire Food Bank has been in Sonoma County active since 1987, and we offer food distributions directly throughout the community, about 300 distributions a month. And then we also have a nonprofit partner network of faith-based organizations and nonprofits, 130 additional organizations that include hunger within their scope. So it doesn't necessarily mean that that's their core function. They might focus on other, basic needs like housing or childcare, but understanding that the population that they serve could also benefit from really access to food throughout the year. And they might use food from the Redwood Empire Food Bank that gets people into services, keeps them nourished while they're otherwise keeping them, housed. And so we're happy to work alongside 130 organizations to really just be as healthy and consistent and robust of a supplemental nutrition program for people facing food insecurity.
Fantastic. 130 partner organizations. That is pretty incredible. Most of us, heard about a pretty big kerfuffle in November. So we had all these challenges with the federal government. There was the shutdown, there was the SNAP benefit pause, and really the food bank was sort of front and center. People were talking about CalFresh and SNAP benefits being cut. What is the current status of the food bank now that SNAP has been sort of semi-restored and things are kind of moving forward? Although we do have a looming, probably potential shutdown again coming at the end of January. But can you tell us how kind of the SNAP closure, the government shutdown impacted the food bank's operations? And is everything back to normal now? Or what's the current state on the ground at the food bank with all the SNAP confusion?
Yeah, so people were definitely confused and concerned, even starting at the very end of October, with the looming inevitability of the shutdown and then the disruption to people's SNAP CalFresh benefits. So the end of October, we definitely had a lot more referrals and people reaching out to say, if my benefits are disrupted in a few days, what do I do then? We really served more people than we ever have in such a spike. And that was only really because, honestly, if you had asked me prior to November and said, how many people do you think that the food bank is serving already accesses CalFresh? And so how many people do you think are probably getting both, where they have supplemental groceries from the food bank and they also have CalFresh benefits? And I would have just said, oh, I'm sure most of the people that are on CalFresh also rely on the Redwood Empire Food Bank. And I fear that I was actually wrong. There were a lot of people that were calling us for the very first time and learning how to access the food bank for the very first time. And I was really surprised by that, only because they could be accessing both simultaneously and arguably should, just to be sure that their family's food needs are met throughout the month. And so normally we have about 500 new families that sign up every month to access the Redwood Empire Food Bank, and we saw 1,900. So
Oh,
that was just, yes, it was really incredible. So people they came as a real spike in the beginning of November. And then as soon as those benefits were restored, people go back to their typical behavior. So they say like, okay, good. Now I have what I need again. I'm going to resume going to the grocery store. So we haven't continued to see this like huge spike into, now almost January, except for it's a tricky time of year because sometimes we do see an increased need anyway because people's utility bills, at least if I speak for myself, have completely skyrocketed, even though my house is still a little bit chilly, my kids would argue. So there's an element of this is a more expensive time of year for people, and we don't ask people, the gory details of their finances, or if they're on CalFresh, or what barriers they have to, you know, being financially independent. Like, we just say, we're so glad you're here. We're happy to help. So I don't have exact metrics of who's turning to us and is continued to, but just knowing that, people are people and they've gone back to what they relied upon before. So sure, some people have continued to rely upon us, but not every single person of those 1,900, has continued to rely on the food bank, at least, in this up until this moment. But like you said, there might be more potential disruption with our government.
So that kind of leads to my next question. So, I mean, if you asked 100 different people how a food bank is funded, or who is the food bank, or what organization runs the food bank, you would probably get 100 different answers. And I know that, I used to think that the food bank was, oh, there's probably some federal government entity that funds most of the food bank services, and the county and the state. And, that really is not the case. And so I know there have been quite a few changes at the federal level and at the state level that have really impacted the food bank in a negative way, or made it harder. Can you talk a little bit about any other changes from the federal government that have impacted food banks, or maybe changes from the state level that impact food banks? And really, at the end of the day, how much of your funding or support actually comes from government? Can you talk a little bit about those changes?
Sure. So we really, because the need for food banks across the country really skyrocketed because of the pandemic, we, as a food bank, were just relying, like a lot of other food banks, on saying, okay, well, thank goodness we still had USDA food and funds flowing into our communities. And so back in March, we learned that truckloads of food would be canceled, that we would no longer be receiving supplemental food through the USDA.
Wow.
So at that time, it was 9 truckloads of food that would have arrived between April, May, and June as that last quarter of our fiscal year. And suddenly, those truckloads of food were just gone. And that was true across the country. So for us at the Redwood Empire Food Bank, it was $750,000 worth of food. And there's no way that we could just on a dime say, well, we're going to instead buy that milk and eggs and
Right.
frozen protein that would have shown up on those truckloads of
Right.
food. So at the time, especially eggs at that time were like $8 a dozen. It was ridiculous. And so we just said, okay, we're not going to be providing eggs at all. And we really have to change our provision of help. So before, people could consistently rely on milk and eggs and protein as part of what we would offer when they would turn to us. Well, we said, like, we can't keep doing that. We now have to rotate through frozen protein, shelf stable protein, and that's what we've maintained ever since. So we're actually providing less food than we were a year ago in terms of what people would expect when they turn to us. And we've really focused on what's nutritionally most valuable to people. So we still have a bounty of fresh produce. We still focus on protein when we can. But I think one myth and assumption is that the food bank just gets food donated, that we don't buy food. And that's not entirely true. We have to buy food. We don't get enough donated food to sustain the need. And the only food that's actually free to us is USDA food, even donated food. So donated produce. We spend $4 million a year on free produce.
Wow.
So riddle me this. So the idea is we have to get it here. We have to
Right.
pay for transportation. We have to pay for fuel. We have to pay our staff to transport that produce here.
Refrigeration and all those things that go along with that.
Yes, and
Yeah.
we're food. So we have public health and safety audits, and
Right.
safety is really an important part of our culture here. I mean, we
Right.
take that with utmost respect and priority for us. And so, we have rigorous protocols around the handling of that food, and it's perishable. And then we have to get it back out and transport it back out to the community. So the idea that we're spending $4 million on free produce, there's no better way for us to spend it. It's the healthiest thing for our
Totally.
community, and it's expensive for people to otherwise buy. But it is really important for our community to understand that most of our funding comes from individuals. We used to rely on about 20% of that funding coming from the government. And right now, this year, we're sort of saying like, "Ooh, I don't know what the number will be,"
Right.
because it's been a little bit of whack-a-mole. California did provide state funding for CalFood, which is basically California dollars to buy California product, which is wonderful. We did not think that that would make it into the California state budget, but it
Okay.
did. The only unfortunate thing is, it's already been spent. So
Right.
our allocation was about $675,000 of the 80 million. So people heard 80 million and they went, "Oh, great, food banks are all set." No, it's actually not that much money when you divide it up by so many food banks. And we spent that on that fresh produce within, I mean, by the time the government shut down, we had already spent that funding. So, and I don't want people to hear me and think like, "Oh gosh, the food bank is in trouble," because we're not. I mean, we absolutely want people that are still needing us today to absolutely rely on us today.
Totally.
It's just important for me to also say to people that want to help and want to get more involved that we absolutely could use their help. So I don't want to sound doom and gloom, but I do want people to understand, it's complicated to just encourage people to come to us when they need us. Probably takes them 30 days longer than it needs to. I mean, they can come to us immediately. They don't have to wait until, they're really struggling.
Gotcha. Gotcha. Thank you. Talking about struggling kind of local community members, it's been a really frightening time, I think, over the last 6 to 12 months, I guess, if you will, for our immigrant community. So we've got a lot of fear out there. We've got a lot of issues with immigration. There's a lot of folks that really need the help and are afraid to access those supports or are worried about public charge or having their information shared or having loved ones deported or arrested and a variety of different things. We've been doing a lot of speaking with different immigrant supporting organizations here in Sonoma County. And the three things that folks are asking for are needing right now is pretty unanimous. It's folks want to work, they want a job. They don't really want a handout. They'd like to earn or earn their income. Just an opportunity to earn income's the big number one. Number two is affordable housing. Like everywhere else, affordable housing is just really hard to find, right? For immigrant communities struggling with immigration issues and all sorts of other things and job loss, it's even more challenging. And then lastly, it's food. It's people, they want access to food to make healthy meals for their families. Sometimes they're looking for things that maybe culturally responsive foods, beans, masa, things that folks can really kind of stretch out. Do you have any words of advice for folks out in these communities and maybe are afraid to access your sites or are looking to access services that maybe have been hesitant to do so far? What can we share with the immigrant community that needs a little food help from the food bank?
Yeah, so we, really several years ago started a campaign that all are welcome here. And we ramped that back up about a year ago, knowing that that would be a concern of people in our local community to say, like, what now? What do I do if I'm, concerned for my information and concerned for my family members? Because most of our food distributions are out in public, and that's by design because we want to be accessible and we want people to know where we are, but then that can be tricky for that very same reason is that we're out, at a community center or at a school or in a public parking lot. So what we really have is a robust proxy system. And so it just allows for somebody to give permission for somebody else to pick up for them. That has existed for a long, long time. So that's really just about convenience and people's work schedules and if they have a medical appointment or they otherwise don't have their own, physical abilities or a lack of transportation, whatever the case may be. So people can always have somebody else pick up on their behalf. Of course, if somebody's signing up for access to groceries with us, we do ask basic contact information. But honestly, people could choose an alias and that's okay too. We just ask that they are always that alias. So if I say, my name is Mary Smith and I have, 4 children at home, that I'm always Mary Smith with 4 children at home. Because quite
Got it.
honestly, the Redwood Empire Food Bank doesn't necessarily care what my name is, but we are going to greet you and say, "Good morning, Mary." And you shouldn't wonder why we're calling you Mary. But we also ask that that person is always that person, because
Gotcha.
really that just allows us to plan and execute and have the data to say, like, how many people are we serving? How do
Yep.
we plan for this for next year? So it's less about who that family is, but the composition of how many of them are they,
Right.
and how often are they coming for groceries, really from a planning purpose. It's not, it's not to really hone in on their household. So all that to say, we do ask basic contact information. The 130 nonprofit partners that we have, a handful of different methodologies exist within that system. And so somebody could go onto our website, click the button that says get food, and they could better understand, what food resources exist, and also the sites that are run directly by the food bank and others. And so they could always call and say, okay, so what do I have to do to get started? But ideally, we have all that information on our website, for them as well. So all that to say, we do not ask immigration status. We do not ask people to prove income. It's all self-declared. And again, we pride ourselves on being respectful and kind, and some would argue delightful, and really just welcoming people to come and get the groceries that they need. So,
Gotcha.
yeah,
So you can show up to a food bank distribution. You don't need to show ID, address, all those different things. You can just come and get what you need in a way
right.
that is safe and comfortable for you.
Right. Right.
Got it.
We do ask, how many people are in the family. If somebody wants access to infant diapers, we do, have
Okay.
a program around that, just to say, like, how many kids do you have? And is there some unique form of said children
Right.
existing, like they're physically in the car seat, for example? And we do have a senior box program for people over 60 that is a USDA program that has a requirement, but the ID can be a library card. So it doesn't even necessarily have to be a formal ID that, is permanently logged into any system. It's just a way to ensure that the people that are coming for food, that it makes its way to them.
And we've talked a lot about the distributions. For folks that maybe have never attended a distribution or gone, like what is there? What should they expect? What can they get? What do you guys provide? We've heard a little bit about culturally responsive foods and folks wanting access to certain things. If someone were to show up at a distribution, what would they see?
It's absolutely client choice. And so even if there's something that people say, "Oh gosh, honey, I only need 2 apples, it's just me at home," versus a family that says, "How many apples can we take?" So we don't pre-bag anything anymore. So we even used to pre-bag produce and have that in, 4-pound mixed mesh plastic bags, and we don't have that anymore. So really, it's total client choice. So even if there's something, back to the cultural responsiveness, if people say, like, I have no idea what to do with that squash, they can just say no, thank you. We do offer recipes and things like that so people understand what they can do and prepare with the food that we provide. But it's a bounty of fresh produce. Usually 50 to 55% of what we provide is anywhere from 10 to 13 different varieties of produce throughout the year, at any given time. So it's really, dozens more than that if you add it all together. And like I said, we rotate through protein. So ideally, we have frozen protein available, but that's usually a couple times a month. And then the other couple times are shelf stable proteins. And then any donated food we can get our hands on. So food drives are always a fun way for people to donate food. We partner with grocery stores. And so we pick up whatever the excess is that they, can't sell. And that goes out through our partner network as well. So really, there's a lot of variety within that system. And again, people can say no, thank you. So we just encourage them to come as often as they need, and find a rhythm that works really for their family.
Awesome. Awesome. As we were talking here, I'm looking at the website, refb.org, which is fantastic. And I notice right on the front page, there is a little click box with a flag. If you click that click box, it will translate the entire web page into a language of your choosing. It looks like there's 10 or 12 different languages there. So if folks are needing access and they speak a certain language, it looks like that page is fully translatable, which is fantastic. So refb.org is where people could find all this information, correct?
Yes.
Awesome. Awesome. Let's see here. It's the Redwood Empire Food Bank is such an interesting organization. As the executive director, Are there any programs that you'd like to spotlight or showcase or that you're really proud of?
Just the fact that we try to meet people where they are. And so, in terms of where we're located, it's in schools, it's in community centers, senior centers, affordable housing, really just to have people not have to work too terribly hard if they're already working a couple of jobs and have outside stressors. We'd like to be as conveniently located. We have evening distributions and Saturday distributions and throughout the day of the week. And so I think sometimes one of those assumptions is that like they only have, morning weekday distributions, and we don't. We have evening distributions throughout the community.
Awesome.
And again, that robust proxy system. And so people can really lean on a friend, relative, neighbor. They don't have to explain or justify why that relationship exists or why they're having somebody else pick up for them. And really just we want to partner with local food producers and agriculture. And so we're eager to really offer anything that we have. If somebody's just perusing our website, we have farm to table programming. We have on the spot nutrition, which our chef makes meals here that we hand out to people. So as they come to a food distribution, if they're hungry, they get offered a meal in that given moment. All the ingredients and allergens are on those meals. People find it to be really fun and accessible. Chef Dawn is our one employee that works with volunteers, multiple shifts a week, making about 5,000 meals a week. And it's really
Cool.
just a way to say, we're so glad you're here and let's offer you some nutrition upon arrival. And he uses a lot of the same ingredients that we're offering.
I
And
love
so
that.
it really allows people to see like, oh, wow, okay, what can I do with the same
Love
product
it.
that the food bank is providing that, Chef Don is using to put in those on the spot nutrition. So,
That's awesome.
um, yeah, just we're really honored, honestly, to do this work. And so, however people want to get involved or want to learn about our work or want to rely on us for a safe and accessible way to get food for their family, we encourage all of that.
Awesome. Awesome. And so this is a great segue into my next question. We've got 740 employees here in the County Department of Health Services, and I intend on sharing this video out with those folks, and some may watch it, some may not. But, I know a lot of us got into county work because we want to give back. There's a sense of purpose and mission that drives us to do the work that we do. And that's not just during our 9 to 5. A lot of our employees want to volunteer or get active or contribute financially or donate food or do a variety of different wonderful and amazing things. How can people help the Redwood Empire Food Bank? How can they get involved? Do you need volunteers? Do you need financial contributions, food? What is the best way for our staff or the community or anybody that's watching this video, if they want to get involved and really combat food insecurity here in Sonoma, how can they help?
So the easiest way is they can give a financial gift. And so the reason I say that is because we do buy food by the truckload. And so we can stretch a dollar differently than, honestly, if I'm being perfectly honest, because I work here, I know that we do a spread the love campaign for peanut butter. And I was at Costco yesterday and they had peanut butter on sale. And I went, ooh, I'm going to get some of that for our spread the love campaign. So there are ways, even myself, I give financially because I know we can stretch it, but then I also buy peanut butter so then I can give when we're doing spread the love. So, there is no perfect right way or wrong way to do it. People can get involved in any way that feels comfortable to them, but they can give really easily. We have even monthly giving programs that some people say, oh, cool, I just want to give $20 a month and I can kind of set it and forget it and get the occasional email from us letting them know what we're up to. And then other people really are inspired by a match. And so they say, ooh, I like a good healthy competition and I'm going to, give when the food bank is doing a particular match, or a food drive where they want to pick up. Again, I'm a sucker for it. I picked up the peanut butter already. And so that's a way for people to get involved. And then we always have volunteer shifts. So people that want to be really forward facing, we have food distributions that always need volunteers. We have shifts in the kitchen. If somebody really, they don't have to be a culinary expert. They can hang out with Chef Don and he'll teach them all they need to know. They just need to
Awesome.
Yeah, food handler certificate. We have shifts at our distribution center here, gleaning produce and packing senior boxes. And then we also have farm partnerships. And so, of course, there's seasonal need around that. But if people say, "Oh gosh, I want to have the full food bank experience," they could volunteer in all four areas.
That's fantastic. Well, thank you for that information. I did want to kind of conclude our conversation or sort of wrap up with a quick announcement and a surprise for you, I hope. In November, a couple of our staff got together and really wanted to give back in some sort of meaningful way as an agency. And so they got together and started a food bank campaign. And so this was kind of the same time with all the SNAP challenges, and they pulled together, and a couple employees actually hosted a food drive and a fundraising drive for the food bank. And so I wish I had a big check or something fancy to present you today, but I don't. But in the month of November, the Department of Health Services here in Sonoma County, we've got about 740-ish employees. They were able to donate 600 pounds of food and $1,700 to the food bank in the month of November. And so I don't know how that was transmitted to you or got to you, but it did, I think. And so just a big thank you to our staff and a big thank you to what you guys do there as well. And we'll continue to probably annually support the food bank and try and find new ways to do that. So 600 more pounds of food and $1,700 is not too shabby for 1 month. So I wanted to let you know that that's what we submitted in November.
Great. Thank you so much. I mean, thank you to everybody that, even, people sharing and saying, "Hey, I listened to this interview between Nolan and the food bank, and it was really great. And I learned a lot. And, here you can too." So I think even, people sharing what they've learned and sharing what they know is an important part of our work, because there might be people in your life that could use our services and you don't necessarily know that either. So it's not only in the "this is how I gave and you should too," as much as just talking about our work and how we do it, because you never know when somebody might find themselves with extra time that they want to volunteer, or, in need that they would actually be turning to us for help.
Awesome. Awesome. All right. Well, Allison, it was an absolute pleasure to hang out with you today and learn some more. I really appreciate everything you and the Redwood Empire Food Bank do. And I think that pretty much concludes our conversation today. One more time for folks, what was your website? Where can folks find for more information?
It's refb.org. So thank you so much for having me. We're happy to be in this community and honored to do this work.
Thank you, Allison. Have a wonderful New Year's, and we'll talk to you soon.
Thank you. You too.